Greetings, everyone. It's my honor to speak at KMU International Conference on BioMedicine. I'm Dr. Yinghui. I'm working at the Kaohsiung Medical University Hospital now. So here is my education and experience. I am the specialist of Taiwan Academy of Operative Dentistry and the specialist of the Academy of Endodontology in Taiwan. And I have the experience using the digital tool, including oral scanner and navigation system. And also I have ability to use the software like 3D Slicer, Blender, and Blue Sky Plan, this kind of dental software. So today I'm going to talk about the application of AI, 3D image, and digital navigation in precision oral medicine, which is an endodontic perspective. So here is my outline today. I'm going to have a brief introduction of modern endodontics. And the second part, I will be talking about the 3D imaging and digital navigation in endodontics. And the third part will be AI application in endodontics. And the fourth part will be the future outlook of endodontics. So let's begin with the brief introduction of modern endodontics. For those who are not very familiar with the endodontic treatment, and the endodontic treatment, the tooth, if we have some bacteria and the food debris or the plaque on the tooth, the bacteria will accumulate on the tooth surface with the time goes by. And when the plaque is for the plaque formation at the tooth surface, it will produce acid, and it will affect our tooth until someday it will affect our pulp tissue. So the endodontics, or we so-called root canal treatment, is trying to remove the pulp tissue and the bacteria inside the root canal with our rotary system and our file and some cleaning irrigation to remove all the tissue and the bacteria in the root canal system. And we will fill the root canal system with scalp aperture. And in some case, the bacteria will colonize, and it might be go through the apical foramen and go to the tooth root surface. So in this case, if we only do the root canal treatment, and this the patient's symptom will not decrease. So in this kind of case, we need to do the apical surgery. So here is the apical surgery. We will reflect the flap, remove the apical lesion, and cut the root tip, and use ultrasonic tip to remove the gutta percha and the infection source at the apical. And we will fill the apical with some kind of MTA, like some kind of bioceramic. So this is our modern endodontics. We use the microscope and ultrasonic, and of course the CBCT, and we have a lot of different kind of rotary system. To all this new technology we can use to do a fine modern endodontic treatment. So here is the traditional endodontic treatment. We will use high-speed burr and GG drill and to do the sterile access. But nowadays, we usually don't do very conventional access opening, which is more big. So in this picture, you can see the red one and the blue one and the purple one is progressively bigger. So the purple one is conventional access. So nowadays, we might to use the green one, which is more conservative access opening for endodontic treatment. And we have plenty different kind of access opening, but we are not going to talk about all this today. And this is the anterior tooth. Which I want to say is that we have a lot of new technology that we can do more conservative endodontic treatment. So here is some other instrument that we used to prep the apical retrograde preparation, which in the apical surgery. And we have a lot of different kind of mini blade, like micro blade, or to do a very nice incision. And we have different kind of surgical instrument for our apical surgery. So here is our apical surgery. We will cut the 3mm root tip and do the we do the retrograde preparation under microscope, which we can see very nicely when we do the retrograde filling under microscope. But our problem is we still have to speculate and visualize to do the endodontic treatment when we have no digital instrument, without digital tools. So we have the information maybe from CBCT and maybe from the tooth anatomy, which we know, and we put the anatomy and the CBCT image together, and our dentist imagination what I'm doing when I use the ultrasonic and the root canal and the microscope when I do the endodontic treatment. So in some case, we had like the calcified canal, which is not very detectable in CBCT, or when we do the apical surgery after we reflect the flap, but we cannot see directly the root tip. Where is the root tip? And where is the canal? So when we lost in the root canal or lost in the apical area, we can use the navigation, which lead us to the second part. We use the 3D image and the digital navigation in endodontics. So maybe we are more familiar with the prosthodontic or restorative dentistry. They use the scanner to put your reality tooth structure, use scanner and transform it into digital world. And after we do the CAD design, we do the computer aided design in software. We use CAD to deliver the digital information into reality, like use the Serac or any kind of mini machine. So this is the circle of which we are doing as restorative and prosthodontics. We scan and we make it in the digital world, and we use CAD to back to reality world. So this is the circle. So in the endodontic world, it's also the same, but we are going to use, we have reality tools and the scalp and the maxillary mandible bone, and we use the CBCT and oral scanner to get this information into digital world. And when we need to do the endodontic surgery or the endodontic treatment, we use the navigation and the 3D print guide to use the information back to the reality. So here is some clinical case. This one is a retreatment case. This 246. They have apical lesion here, and we are trying to do the endodontic retreatment. So we remove the crown, and we cannot find the mesiolingual canal, which is obliteration, or we say the calcified canal. We cannot find the mesiolingual canal. So here, this green circle is which we are going to do the guided endodontic to use the 3D print guide. So here is the planning of my drill pass. So here is the drill pass in different slice, in different like the sagittal view and the coronal view. So here is the horizontal view. Here is our drill pass. So I designed a 3D print guide, which is here. And here is the reconstruction of the CT scan, which use the 3D slicer to produce this kind of navigation to let you know where is the drill pass. So I print out I use the 3D print to print the guide, and I put a cylinder here, the sleeve, which matched to this bird. So I perform the endodontic treatment. I use this drill pass to find the mesiolingual canal, which is here. This is pre-op and this is post-op. So after I find the mesiolingual canal, I finish the root canal treatment. And here, as you can see, this is more radial opacity, which is my drilling pass that you can see here. So I finished the root canal treatment. And here is the 2-year follow-up. 2 years follow-up, we can see the apical lesion is healing. So next one is also a root canal treatment, retreatment, but after the retreatment is not, the patient still have symptoms, so I do the surgery. So we saw that we remove the crown and post first. We do the endodontic retreatment, which we have 2 canal in lower premolar. So we do the root canal filling here. But the patient still feel uncomfortable, so we decide to do the apical surgery. So here I take the CBCT image out and fuse it into fuse the oral scan with the 2 model. I fuse it together and form a model with 2 structure, which is from oral scan, and the bone tissue from the CT scan. So I make a surgical stent, which is attached to the bone. So here is the 3D print guide, and here is the surgery procedure. So I reflect the flap. And after the flap was reflected, you can see there is no penetration. You cannot find the root end here. So we use the 3D print guide to drill a hole. And I remove the apical, remove the bone and the root end together, which you can see is kind of a cylinder here. So and I do the retrograde preparation. And after the root canal filling, root end filling, we put the bone plate back and suture. So here is the root canal treatment, the retrograde, the root end cutting, and the retrograde preparation, and the MTA filling. So here is the suture, and here is the root tip. I just cut it. And here is the post-op, and we have 2 years follow-up. As you can see, the lesion is healed, and we put a new crown on it. So here is the full design of the surgical guide here. So I use this case to produce some kind of 3D print model to teach our student, to teach our resident to do this. So I print it out, which is the bone surface and the soft tissue surface, and I make a soft tissue here. And as you can see, I make the root canal is achievable. So we do the apical surgery, which is using 3D print guide, and part of we use the navigation system. So I'm going to have another teaching at this December. Use a new form model. So next one is piezo surgery, which is almost the same. Just I use the piezo surgery, piezo to do the surgery. So here is a 3D print guide, which this rectangular is for the piezo. So I sounding the bone first to find the bone margin, and here is my flap design. So I reflect the flap, and I use this piezo surgery instrument, which from the co-mate, and I cut the bone plate, as you can see, and I remove the bone plate, and I do the root canal apical surgery, retrograde preparation, and retrograde filling, and I put a tallow plug and put the bone fragment back to the area and perform the suture. And here is the post-op, and I have 5 months follow-up, which is no symptom here. So next one is the auto transplantation, which we have 47 vertical root fracture. And I do the model surgery, which is the virtual surgery to move the 48 to 47, the area. So I plan a surgical guide, which with this cylinder burr here, which can cover the root tip, the root surface of the donor tooth. So here is the root 3D print guide, and here is the procedure. After I extraction the tooth, the 47, and I curettage, remove the granulation tissue, and I use the 3D print guide to prep the recipient side for the donor tooth, the anatomy of donor tooth. So I put the analog first and try is that okay, and after I make sure the extraction socket is fine, I just extraction the tooth and put it into recipient side. So here is the donor tooth and the analog. And here is the vertical root fracture in the 47. And here is the pre-op, and here is the post-op. So this pre-op and the digital planning and the post-operative. And I finished the root canal treatment. So I have 2.5 year follow-up, which endodontic treatment and the onlay on it. So here is another one is the navigation system, which I try to find the mesiolingual canal in this tooth, and we can, as you can see, the ultrasonic tip, and I do the navigation system. You can see simultaneously the microscope image and the navigation system. So here is the post-operative. As you can see, we find the mesiolingual canal. And here is another case, which is upper molar. We find the mesiobuccal second canal with the ultrasonic with navigation. And here is another case about the dynamic navigation, which this patient is followed at our perio department for very long time. And as we can see, at the first, this tooth got a big amalgam restoration, and as the time goes on, you can see the amalgam restoration, the peripheral tooth structure is a little bit decayed after time. And as you can see, the pop space is quite obvious at 2014. But you can find that the pop space is not very clear after so much time. So it got a canal calcification. So a patient come to our department complain about the soreness of this tooth. So we designed to do the endodontic treatment for this tooth. And after I open this tooth, I cannot find canal. So before I think it's too late. So I did if I perforated it, it's too late. So I sent patient to take a CBCT, which I put Vitapex here, and that's obvious because I'm almost perforated here. Is less than 1 millimeter. So that means I can stop in time, which I am a specialist. I have trained by this, so I know what I cannot do. I cannot find this, so I need CBCT. So after this, we take CBCT. As we can see, my direction is right. I go with the right axis of this tooth, but it's C-shape. I cannot find here. Here is perforation, so I need to go this two-way to find the C-shape. So I perform the navigation system to these two drill paths to reach the C-shaped root canal. So here is the video which I am doing the navigation system to find the root canal. So here is after I find the root canal, I feel the tooth, the C-shaped root canal. So here is the 6 months follow-up. So here is another case of dynamic navigation for the endodontic for the apical surgery. So it's almost the same with the 3D print guide, but it's just a dynamic, which is real time. So I planted two cylinder here for the apical surgery. So here is I'm performing the apical surgery, which we can see the bar here is going yellow, and it will go green and to red. When I reach green, it means I'm in the position. And when I reach red, it means I'm over. So as you can see, I'm drilling it. Oh, it reached green. It reached green. So that means I'm almost there. And if I go through that, it will go with red. Yeah, that means I'm over. Okay. So here is the image that I perform. I finished the I remove the bone plate. And remove the root end. Okay, so here is the root end preparation. root end preparation, and the apical MTA filling. And I always put the bone plate back to the area that I'm not I will not put some bone graft there because the bone plate is fine. So here is the post-op, and 3 months follow-up, 6 months follow-up, and 1 year follow-up is fine. Okay, so the next part is AI application in endodontics. So as we can see, the AI can do a lot of things for us. A lot of things for us, which including the disease diagnosis and treatment planning and prognosis and landmark detection and the risk assessment, like that. And if we train the AI, we locate the AI, locate the cavity. We label the cavity in the image, and AI will able to tell us where is much more likely to have caries there. And also we can use some different algorithm to catch like the oral cancer lesion in the picture. And of course we can locate the apical lesion at the panel for the using the artificial intelligence. And also we can use the artificial intelligence to check if there is any is the root canal filling is correct or incorrect, which they show this picture. This one is correct, it reached the end, and this one is incorrect because it's a little bit shortened. So it used the deep learning network like this. So here is the comparison of YOLO artificial intelligence and the inexperienced endodontics. It's almost the same, but the AI is better. And someone might ask why we don't compare the AI with the inexperienced, why we don't compare AI with experienced endodontics. Because in this research, the experienced endodontics is the gold standard. So that means the experienced endodontics, they are the answer of the AI. So they are 100%. So you cannot compare the experienced endodontics with the neural net, the artificial intelligence here. So that's a problem. So of course the AI is very fast. It can diagnose that is that the root canal filling is fine, is correct, very fast. And a doctor needs time, right? Of course, they are computer. They compute very fast. So here is the another one. They can use the segmentation to isolate the apical lesion in CBCT, also in 2D and CD, and 3D. And in market, they are already developed a lot of this panel. They can isolate every tooth and try and to evaluate the bone level and the CEJ level. And this is another company that have similar software and which can locate the caries here. And the different the orthodontic also have some automatic cephalometric and analysis, and the tooth segmentation and the airway volume segmentation. And this is another one. It's called DiagnoCat. And personally, I also use the 3D slicer to do the image leveling. So here is the leveling. I use the drawing pad to level the tooth and the different tissue like tooth tissue and root canal and different tooth and the bone surface. This is the leveling video, which comes to the this is outcome. Left side is the original CT, and the right side is the level. You can see the tooth, different color tooth and different color root canal. So here is the outcome, the CT, original CT. Here is my level, and at the right side is the prediction. So the up here is the human level, and the low here is the AI segmentation. As you can see, the bone is very easy, and the tooth is easy too, and the root canal is not so easy. As you can see, it's kind of broken or a little separated, and the anatomy is not completed. So here is my outcome, which is jawbone is 96% and tooth is 92%, and the root canal is 84%. The root canal is more difficult. So it comes to the final part of this speech, which is the future outlook of endodontics. And of course, we are going to go into the robotic surgery here. Here we have different departments. They also do. They all do the robotic surgery here. So this one is using the Yinghui dental robot. Is from an American company. They do they produce this robot here. Okay, so as you can see, you can find the Yinghui information in YouTube, and here is in the paper. They use this split and tracking arm. So this is almost the same with the dynamic navigation, but it just used more. It got a robotic arm there. Okay, so this is the video they performed this at the BU, the Boston University. Yeah, here is their surgery. Okay. So here is another one. They use the this robot is from China, and they do the apical surgery here. It's called ICOBM. This one is the China company. So you also can find some video online in their website. Here is their planning. They do this and the apical surgery here. Okay. So here is the full concept of the robotic surgery. They also have the dynamic navigation tracking system, but they use robotic arm to guide you. That they will restrict you from. If you offer a track, they will tell you, or you cannot offer a track with the robotic arm. And we also have the ePad navigation system, the robotic surgery system. In Taiwan, which is 2021 TFDA approved. And here is my video that I made in 2022. I used almost 6 months to do the whole series, which I do the digital online lesson, which I make our resident to prep the tools, to scan the tools, and to design the tools by themselves and to kick in the on layout and to do the segmentation. I used 6 months to do this teaching. But recently, the 3Chef already announced this AI designed the function, AI design function, which can do onlay or crown just within 10 minutes. So I mean, the AI is very fast and I cannot catch it. I use 6 months to teach this, but they use they use 6 minutes to finish this. And another one, I do the segmentation. I do this 3D slice adhesion too. And here is the blue sky plan. And it also is very fast, which I spend a lot of time to do the segmentation. And here, they just fully automatic AI and to do this kind of tooth segmentation. They are very fast. The AI is very good here. So I also use the blue sky plan to do the EPCO 3D print guide, which I upload this video last month. So I think here is my full experience of my my career, that I use CBCT to capture the 3D image, and I use oral scan to scan the tooth, and I use 3D printer to produce the guide, 3D print guide, and I use the navigation system to do the epical surgery. So here, I think here is my full speech here. If there is any question, I'm happy to answer. Thank you.